Now at 6, America's opiate crisis continues and debate grows about how to address the issue. One local couple says there is a side of the story not being told. A report from a local opiate prevention group shows that opiate-related overdose deaths continue to rise here in Milwaukee County.
In 2013, the number of overdose deaths in the county was at 181. Last year, that number jumped to 294. 10 months into this year, 2017, we have seen more than 300 overdose deaths in Milwaukee County.
People in chronic pain are now being told that they can't take the same amount of medication they're used to. Ricky Mitchell spoke to a woman suffering from a painful genetic condition. She joins us now with her story.
Well, Shannon, the CDC changed its guidelines last year, recommending doctors try other treatment options for chronic pain before painkillers and prescribe the lowest effective dose possible. For one woman who takes Percocet, that has left her scared of what's next.
I don't know if I will survive it.
7 years ago, Amy ran marathons and she worked as a nurse. But then the back pain started, moving to her knees and hips until she couldn't even get out of bed.
I had to use assisted devices like a walker, at times a wheelchair.
Amy and her husband Pat asked us to conceal their last name for safety. After multiple surgeries, Amy says doctors diagnosed her with a genetic condition that causes chronic and debilitating pain in her joints.
I became very depressed. I had suicide thoughts before this doctor saved my life.
A doctor, she says, who put her on an opioid regimen almost 4 years ago. But now doctors are telling her she has no choice but to start taking less.
Amy never complains, but we can't take away the tools that are allowing her to hang in there.
A spokesman for her clinic says a few weeks ago, the medical director said they would begin tapering down dosage levels for chronic pain patients and offering other options like physical therapy and acupuncture. Dr. Dermot Moore O'Farrell is not Amy's doctor and does not work at her clinic, but he says higher doses can increase the chance of accidental overdose by up to 900%.
So there are many other strategies that we can do besides just prescribing an opioid to help reduce the patient's pain and improve their function.
Amy says she's tried other strategies, but they aren't covered by insurance, and she says nothing has helped.
When you're in chronic pain, it drains your energy. And if I can't get out of bed, if I can't get in the shower, what kind of life is that for me?
More than 40 Americans die every day from painkiller overdoses, according to the CDC. We did reach out to a spokesperson there for comment on this story, but we did not hear back. In the newsroom, Ricky Mitchell, today's TMJ4.